is the Assistant Secretary for Technology Policy, the entity formerly known only as ONC, or the Office of the National Coordinator. It is now ASTP because it has Assistant Secretary status, which it didn't used to. And ASTP ONC, longstanding Gravity members, advocates, across their, health equity by design work and work in supporting fire and accelerators. And I don't know if anyone from ASTP is on the call, but yeah, and then also I help over at ASTP on a couple volunteer committees and boards and things like that. It's the best way to say it. But woo, baby, I'm rocking. Yeah, little Sarah DeSilva, co-chair. Yeah, it's surprising the things that you do when you're trying to be helpful.
I guess we'll all find out what happens to them in a month or two, right?
Well, one thing I want to state that I think is really important to note is that there is a fair degree of consistency and constancy in regulatory government. USDA under the former administration, not that's unique, but looking forward to seeing as well. And we'll put it at that.
Right.
All right. So, okay, 403, here we are. We have so much to cover. This is the merging of all of the work that has happened in Gravity over the fall of 2024. This is the final consensus vote on content. Again, there's some how we phrase things to happen across incarceration and produce prescriptions, right? There's a little bit of tweaking on wording, but the what we want to say, we are at consensus for, and we'll have the vote to testify to this. At least it seems like we are, and the vote will testify to wherever we are. So a lot of content to cover. Thank you for coming, Gravity Director Terminology, Sarah DeSilva, and here we go. Next slide. All right, thank you for joining Gravity. Due to the large number of attendees, participants are muted upon entry. The call is recorded. Recordings are always available on the Gravity Confluence after the meeting. As you all are aware, we encourage all of you to actively participate. There's going to be kind of a meeting in two different sections because this is the merging of two different areas of work. We'll talk about that in a second. If you are chatting or have questions, and again, there's not often a ton of questions in the voting because we just finished end-to-end review for a very long time. So questions tend to not come up, but if you have them, we'll hear them. Just send chats to everybody. Next slide. We are a standards development initiative, and so we are required to abide by antitrust practices. So all Gravity Project participants, including all of you and all of us, have the responsibility to comply fully with federal and state antitrust laws. Individuals speaking or providing written communications have to refrain from any discussion which may provide the basis for an inference. They've agreed to take any action related to prices, services, production, and allocation of markets, or any other matter having a market effect. Just basically do not discuss pricing. Adherence to these guidelines involves not only Julian has so classic Julian. I'm sorry. Always the funny guy, Julian. Adherence to these guidelines involves not only avoidance of antitrust violations, but avoidance of behavior that might be so construed. Thank you so much. Again, this is just part of our requirement as a standards development entity. Next slide. So welcome. If you want to put in your name and where you're from into the chat, that helps us have an understanding of attendance. Your Zoom registration is also part of attendance, but really it doesn't describe enough of you of who you are. We're going to just go through quick Gravity overview, then go right into coding for food consensus voting. Because these two works were happening in separate meetings, there's a ballot just for coding for food, because we figured all of you all coding for food subject matter experts did not necessarily need to stay around for an hour and a half long conversation on the other concepts. And we also figured that some of you might not want to participate in a vote that you did not help develop the content for. Like it would be an abstain, right? So we just figured separating out the voting was wise. So coding for food voting, then going into language. Oh, Carly's here early. Hi, Carly. I thought you were coming late. It's nice to see you. Sorry, I can just see the little pings. Then going into language access and incarceration status, and then some all domain consensus voting. Again, there's a lot of merging of work here, and there's a lot of content to review. And then we'll close with community homework and next steps, which includes sending in absentee votes if you're not voting today, and looking forward until 2025. It's really exciting. Okay, next slide. Again, and for those who didn't hear, I'm Sarah DeSilvi, Director of Terminology, happy facilitator of this space, and really grateful for all of you. Next slide. Just wanted to note for terminology, we're heading into the winter build session. So this is when we always are working on building and always reviewing concepts with SNOMED and always thinking about next steps and always preparing for value sets. But we really focus full steam ahead on the work of submitting coding concepts, maintaining value sets in our publicly quiet months. So we reconvene public meetings on February 6, 2025. And so see you here on Thursday on February 6th, and that includes the new domain starting on February 6th, and then coding for food enhancement starting the week after. So phase 2 coding for food, Katie, coming soon to you in spring 2025. Technical work stream, join us in the public call there from 1 to 2 Eastern Standard Time on Wednesdays. We just finished I just presented at the last monthly implementation affinity meeting just a few minutes ago, and we will reconvene in 2025 for that as well. So the Thursday afternoon call series for terminology and implementation, quiet. Technical stays working because there's a lot of stuff that they have to keep doing, and then we reconvene everything in 2025. Next slide. Just want to make sure everybody knows that Gravity Project released the results of discovery efforts on payment data and exchange standards. We had a really lovely listening session during the technical call time. You can view the report and view a blog about it available at the links. And much of the work that we're doing here in terminology, specifically coding for food, is a direct response to the recommendation 1 of the report, which was terminology, build terminology to support CBO reimbursement. And it was aye, here we go. Next slide. And then just want to note, for those of you, here is ASTP again, Denise, the Assistant Secretary for Technology Policy, Health Information Technical Advisory Committee, which is the committee I have the honor of co-chairing, has convened the Health Equity by Design Task Force. There's all meetings happening through ASTP or public. You can find the schedule and access the calendar, and it's very relevant to the work that we do, of course. So we welcome you all to come and join. Next slide. I'm not co-chairing this committee, but I co-chair that. So really excited for my friends and their leadership there. Any questions on the announcements? Okay, here we go. Next slide. Who we are, who you are, who all of you have become. A collaborative initiative with the goal to develop consensus-driven data standards to support the collection, use, and exchange of data to address the social determinants of health. That is us. You are now part of us. We are really grateful for all of you to be here. Next slide. Incredibly grateful for our members and sponsors. We would not be able to do what we do at Gravity without them, just noting whether it be direct monetary supports through sponsorship, in-kind supports, through our friends who give us lots of resources like American Medical Association and Civitas. I always say this, and I'm going to say it again because it's really important. We are the only accelerator to have a designated membership for CBOs who are doing direct provision who could not afford to do a sponsorship. So we ensure we have place for their voices from a social justice framework. And we're also the only accelerator to have patient representatives throughout our work streams. So again, thank you so much for all of you. We wouldn't be able to do what we do without our sponsors and members. And so many of you that on the call today are here assisting Gravity with governance and leadership and guidance. And thank you for everything you do. Next slide. This is 2024. We're closing out. Here we are at the green dots in November. Go team. Just in time for Thanksgiving next week. And I have a lot of people to feed. We talked about the new use case discovery. We know that tech is working on updates to the ID to align with US Core 6.1. We talked about the last affinity meeting just happening, and we will see you all in 2025. Next slide. And so just we talked again in 2025. One of the things we hope to be doing even more so is leaning in and convening spaces and reconvening experts across our social care voice co-design to ensure that we are supporting the use cases and needs and terminologies that our social care experts elevated in the co-design report. More incoming on that in 2025 as well. But a lot of what we did in 2024 was aligned with that as well. Grateful for all of our experts who helped us with that. Next slide. Let me just make sure I'm not missing anything in the chat. I just see, I see 25 new messages, but mostly links. Oh, I know. Yeah. So the HL7 conference call calendar is hard. One of the things I'm thinking of doing is it might be wise to clean up Gravity's own meetings page because it has everything from the beginning of time. So we want to make sure that people can access our meetings, but the good thing is at least on the upcoming meetings page, this link to this meeting is constant. It will not change, right? So we will see you here again at this meeting, this Zoom invite on January 6th. When we think about 2025, the domains we're addressing, and this is again long time coming, our domain and kicking off new domain work will be topics and person level discrimination, including, yes, February 6th. Yes, ma'am. Topics on person level discrimination, including racism, ethnic discrimination, homophobia, transphobia. We're going to try to figure out what the boundaries are there. But this has, again, been very, very long overdue and, of course, very critical. And then the correlating topics in chronic stress, including minority strain, weathering, toxic stress, and ACEs. We already are convening early. We tend to convene early when we have such critical concepts to make sure that we are centering the right experts and voices in that, and more to come in 2025. And then fall 2025 is food access and neighborhood safety. Again, the neighborhood level domains from food access, from food insecurity and housing insecurity. Yes, Lucy.
Yeah, Sarah, the NIH has just published proceedings of a work group or a conference or whatever about women's health.
Yes.
And one of the presenters was emphatic that adverse childhood events affect not only the children that you discover, but also adults throughout life. So you might want to look at that document, see who said that, and maybe maybe they're an SME for Gravity or not. That would certainly be your call.
Maybe they're already on the list. I know.
Maybe they are, right?
Yeah,
Okay.
so we do adult screening of ACEs in our practice, in family practice on a regular basis for just that purpose, trying to understand. Sorry, it makes me really emotional. But yes, Lucy, yes. Thank you so much. Mark.
Thanks, Sarah. I'm wondering if there's an implication here that the topics for spring 2025 will be finished by fall of 2025, or whether, in my mind, they are big enough that they might take longer than 6 months. So I'm checking to see if that's an intended implication.
That's always the so far with the SMEs we're talking to, they do feel like the work. I mean, again, whenever we throw out a possible scope early, and then SMEs always come, and Cressy is here, he can testify. When we start talking with SMEs early in a domain, like right now, they start to constrain it, right? The expectation roughly is that it's completed within the Gravity normal 6-month terminology curation cycle. It might not involve everything on that list though, because like, for instance, we engendered it like originally to do incarceration and other legal matters, and we scoped it down just to incarceration, right? And another thing of note is we always can extend any build cycle as needed and required. We raise this with subject matter experts every time. Like, do we feel like we need to keep on going? Do we feel like we're sufficient? So Mark, thank you for calling that out. We're working with our SMEs on that right now. And so far they feel pretty comfortable with the normal iteration process, but it might not focus on everything in the person level discrimination area. And that might be a couple cycles of work instead.
Thank you.
Yeah. All right. And then in addition to enhancements to existing domain, addition to the new domains, we'll be picking up Coding for Food again and continuing with our friends at CDC on enhancements to housing instability and homelessness. And then we just presented to the operating committee on hopefully addressing protective factors in 2025 as well. So we do have interested sport to elevate and fund directly that work. So we'll see how that goes. But it seems pretty likely at this time, and it's pretty insignificant and important balancing factor for the other domains we're addressing in 2025. Next slide. Okay, here we are, voting. Okay, so we're gonna first go into coding for food. And then we'll have the coding for food vote, and then we will go into incarceration status and language access and close with that vote. And again, before we go into it, an immense amount of gratefulness for all of you who have helped us get to this point. There's always this, you know, the magnitude moment. I think it hits around like September 5th when people feel the full weight of what we have ahead of us, and then it all starts to settle. So grateful for all of you. Next slide. You'll see these, mentioned and referenced throughout, but our principles just came through significantly throughout all of this work. Specifically, the final principle of preventing, reducing, and remediating harm, ensuring that we're creating concepts that are helpful in telling helpful stories, and trying to minimize bias. Next slide. All right, next slide. Just a note that at the end, you're going to see some of the first concepts from our program gap analysis and CDC housing analysis work. Very soon, again, posted onto the Confluence, you'll see a gap analysis we did with the CDC on housing instability and homelessness. And for those of you who've been in the other meeting, in the enhancement cycle, which was the Coding for Food meeting as well, we've been doing our program classification. So at the end of this, you'll see concepts in purple that came through that work. Next slide. Okay, so how voting happens. We talked about this last meeting. I'm going to review the principles just to make sure everyone's aware. So the way we vote is we vote via Google poll. Unique to this time is we decided to do 2 different polls, again, because Coding for Food, all of you were in that meeting with that process and seeing that content. And there was a separate meeting with everybody who was witnessing all the new domain content. We realized that we needed to kind of separate out the polls. So there's 2 polls occurring during the meeting. You are always able to do an absentee ballot. We've been communicating that. So just let us know at gravityproject8till7.org. That's available for absentee until the 28th. This is what the votes mean. And Sarah B, I think it's the absentee ballot is available to the 28th, just making sure, I think. It's been a long week. What the vote means, again, because this is the intent is that the vote caps off a collective process that we've all contributed to. And that the intent is that that long period of end-to-end review enables a resolution of any concerns or opportunities within the collective, right? So the consensus vote is the mark at the end of that process, right? So a yes vote does not necessarily mean that the deliverable is the ideal one from the perspective of the committed party, but that it's better to move forward than block the deliverable. Yes with comment is a process where you vote yes, and then you have to email a comment by November 28th. And if a consensus process attracts significant comments through yes with comment, as expected, the comments will be addressed in a future revision of the deliverable. Again, it's not like an immediate revision, but we iterate. It's a process. Formal objection, it has to include a comment to honor the work of the collective, right? All of you who are voting are Gravity members who've been here, Gravity subject matter experts who've been part of the work. And so if you're formally objecting, the vote has to include comments indicating a path to address the objection in a way that meets the known concerns of everyone else, right? So it can't just blow up the whole thing. A formal objection without comment defaults to an abstain. These have been the principles we've used for voting since 2019. And something important to note is that we also can abstain, right? But again, this is why we separated, because we figured there'd be lots of abstentions on incarceration and language access from coding for food people and vice versa, because you all weren't in the same meeting. So we decided to simplify things. Just a note that wording, we're voting on content here. The only outliers, really, the only things that have to get really clarified after this vote are about how we are phrasing things. In my, so far, how I've seen, right? Again, I only can go off of what people have sent to me so far. Right, the good thing is with incarceration status, our SMEs are not going anywhere. And so as we think about thoughtful and careful wording and minimizing bias and telling critical stories, they've promised us that they'll walk with us as we model these concepts into terms. So thank you, Kwesi, for being willing to do that. And then we do have a few wording concepts, just thinking about how HICPICs work. And thinking about possible defenses that one would have to make to payers. So there's some careful word choices, but the content of the things that people want to say and what they're saying is remarkably fairly stable at this point and indicates a lot of work on all of your behalf. Immense work. So just noting that we're voting on the content, and then there's slight finessing that happens sometimes, like words change, word order moves around, etc. That's the kind of stuff that might happen after the vote. Nothing significant changing the content of the concept, though. Everyone comfortable about the method of voting? Google poll first, number 1, coding for food on these concepts. And then going into incarceration status and language access, Google poll number 2. Are we good? Okay, without any questions, we're gonna go into coding for food. Next slide. This is it's like Robert's, Brent referenced Robert's rules. This meeting is not very conceptual. It's very like, and now we proceed to the vote, right? So not an incredibly exciting meeting, but exciting in other ways. Okay, next slide. I would not be able to proceed in this work without thanking all the amazing people on the Coding for Food Advisory Committee who helped shape and guide and craft this work and are always there advising Katie and the Fullwell team. Katie, also thank you, my dear friend, longtime friend. Just noting this Coding for Food Advisory Committee, they stay with us as we do phase 2. So incredibly grateful for all of them. Next slide. A specific call out to all of the amazing service providers, dietitians, experts, all the people on the ground in each of our 3 work groups, immense work groups, right? These are not tiny work groups. Immense work groups with very diverse perspectives and different, operational methods of doing these 3 different things across national ecosystems that all came together to create a common concept. Herculean effort. Thank you all. And, as anyone in that work group knows, as the former farmer, food insecurities, food justice person, it was an honor to be with all of my foodies again. I love my food people. So thank you to all of you in this work, our amazing subject matter experts. Next slide. All right, so this is we're starting with produce prescription. Next slide, we came to consensus on the what. Produce and legume provision, again, I'm going to talk about wordsmithing that might happen, again, all to prevent future negotiations with payers, right? Just word choices. The what on the left is agreed upon. The how, wordsmithing, we might tweak a few things. Produce and legume provision align with national whole, fresh, canned, frozen, and dried produce and legume content guidelines. And we talked about those guidelines earlier. Excludes all forms of juices and nut butters. We grounded ourselves in our unit. Our base unit is 1 unit equals 1 cup equivalent of produce per day per week, or the correlating USDA pound per week equivalent. This is incredibly nerdy for anyone who wasn't in the Coding for Food meetings, but it's important. We also agreed that if programs are providing produce through restricted monetary spend, There are standards for cost calculations that exist because the USDA is amazing for general, regional, and local organic produce that can be used for unit equivalents per program operational guidelines, right? We wanted to make sure that everyone understood, and any payer understood the base unit. This is generally understood with a HCPCS concept, but we wanted to state explicitly that the base unit can be multiplied to meet comprehensive guidelines for produce intake per person per condition. So 1 unit per day per week is the base, is like the unit, but 5 units per day per week is the guideline. Right? So if you are a entity offering 5, you do 5 units of this. If you are an entity offering 2, and this is all based on the evidence for the lowest dose with beneficial therapeutic effect, right? So we can defend this to CMS. And then we have our standards, so WIC and produce legume guidelines and the FDA standards of identity. Wordsmithing that might happen, again, that's all agreed upon. Amazing work, produce friends. Huge. Huge. Wordsmithing that's might happen, adding and or to clarify, because I had fresh, canned, frozen, and dried, and so it might be and or, because you can do any of the above. Adding cup serving to cup equivalent, so 1 cup serving equivalent. Some folks thought that might be helpful when they're talking with payers. Clarifying a little bit better the pound calculations for those entities that are accountable to them, and maybe removing legumes. This is like because legumes are a part of produce, and one commenter was like, maybe we don't need legumes called out because produce includes legumes. None of this really is, it's all words because the what is solid. Okay. And I really can't tell you how amazingly hard work that was. Yes, Lucy?
The list of conditions for which there is evidence that intake is beneficial.
Many. Vast. We don't, when you create a service, that's not in the definition, but we have that as part of our evidence and are happy to share it with you.
Thank you. I would like to see it.
Yeah, it's really, it's very exciting.
Is the implication here that as that list changes, these concepts apply? Or do you have to go back every time?
No, the whole point
there's
is,
an-
yeah, this what can be applied to any of those conditions the same way a medication can be applied to anything the FDA then specifies or even off-label thinks it's therapeutically beneficial for. Like this is the what,
Okay,
and then the for what is otherwise argued. But
okay,
yeah,
I just wanted to be
oh,
clear that
yeah.
as the authority responsible for that list may change the list,
Correct.
this doesn't necessarily have to change. You may
No.
want to review it, but
Yeah, it does not.
okay, thank
Yeah,
you.
100%. And that's partly why we have the lowest unit being the lowest unit as evidenced in like science, so that we just don't have to change anything. That we can just like leave this and well, yeah. But thank you, Lucy, for that thoughtful question. Michelle, hi.
I just have a question about the one cup equivalent, the first sort of bullet point there. And that doesn't matter if it's canned, frozen, or dried, or cooked or raw. Well, I guess none of it would be cooked, but you're just using that as a reference for all. It doesn't matter.
Yeah, because there are standards. Like for instance, a cup equivalent of leafy greens is actually not just a cup. And that's like part of why
Well,
the
oh,
cup.
the equivalent. Sorry, missing the word equivalent. Thank you. Got it.
Thank you for picking up on that. And we did, but that's partly what that second bullet, like if that's not exactly clear, we, but we know what we mean. And we want to make sure that we write it to say that. Yes, hi. Oh, I saw the hand go down. Okay, I saw the hand go up. Hello.
Yeah, my apologies. So I'm Cece Brittany with Vouchers for Veggies, and we do a number of produce prescriptions across the country. I really appreciate, first of all, thank you committee for doing all this hard work. It's really, really great work and we really appreciate it. just want to say the comment about I know you're talking about the wording and wordsmithing separate, and I agree with that. But I do want to say that it's really significant to be able to identify just fruits and vegetables as a legitimate produce prescription, and that it's separate. And if you add the other items, that's great. But health plans are taking this very, very literally. And so we don't want to have a really good produce program that doesn't have legumes because they do farm fresh something, not be able to operate. So just, sorry if that's redundant, but I just wanted to
No,
confirm.
you're right. And so that's partly where the and/ors come in. And so if you want to say yes with that comment, that'd be great, right? So that wordsmithing to ensure that everyone who's doing this can see themselves as is what it is, like why we're reconvening. And vouchers for veggies will be there. So hear you. And when we vote, if you say yes with comment, and I recommend adding, like changing this word because of this reason, we're here for you. Okay, go team. Any other questions? Yay! And dispatchers for veggies, Hillary Sullivan. Hello, yay. I almost called her out when Lucy asked the question about evidence, but I just decided not to. Long time Hillary Seligman fan. All right. Okay. We have a lot to cover today. So I'm going to try again. The yes with comment is a really good place to add little, suggestions for adaptations, right? Because we are going to be changing wording, even though if we agree on what. Just because we want to defend all of the different possible swords to this. Next slide. Okay, medical meals. All right. And you're going to see some, next slide, you're going to see some consistency across this concept in medical or groceries, which is what we're calling, and that's by design, because the two work groups really wanted to create standard language across. There are some differences because of the different programs, the different like services, but the two work groups are very clear that they wanted to have common standards because the RDN is very involved in both. Aligned with this is what our friends at the American Academy of Nutrition and Dietetics, hi Carly, I see you on the call, I'm glad you could be here, are helping, which is a draft on changes needed to support reimbursement of RDs to support these services, right? This is all aligned with the HHS Foodist Medicine Initiative and the White House gathering, the anti-hunger gathering. I mean, if there's any time to make this fight to defend the role of RDs and RDNs, it's now. So ready to take that to the mount. But the concept is a meal providing an estimated third of the recommended dietary intake per the therapeutic evidence-based dietary specifications for conditions, evidence-based dietary specifications for conditions prepared using natural foods assigned based on an assessment of the individual's nutritional needs by a registered dietitian or other nutrition professional intended for use in non-facility home settings. Whew, if that's not a technical hick-pick concept, I don't know what is. Oh my Lord. And because of FDA and USDA requirements, we have to specify what we mean by natural. So we do that as well. Natural is nothing artificial or synthetic, including all color additives, regardless of source, has been included in or has been added to a food that will not normally be expected to be in that food. This is whole foods for people. Changes since last time, we added the RD or other nutrition professional to align with the Social Security Act, as you all know. Every single time I become a weird nerd about some kind of regulation. Today, it was like this time it was all the regulations supporting food as medicine, my word. And we added natural with the operational definition to align with USDA and FDA requirements, because every time you use the word natural, according to the USDA and FDA, you have to say what you mean when you say it. Natural is not the same thing as organic, Lucy, because this is what we mean when we say natural, right? Whole foods, no marathon goo. This is the correlation we kept on using, like when you're running a marathon and you can squirt like electrolytes and things into your mouth and like a liquid goo. This is not this. This is food that feels like food and looks like food and is appetizing, because the great thing about binding it to the RD is that's part of their expertise, right? Taking the person and their needs, taking the condition and their needs, and making food palatable and nutritious and good. So not the same thing. Okay, this one probably has less questions. pretty solid. Not that produce isn't, there's lots of different defenses. Oh, hi, yeah, Alyssa's, hi, Alyssa. Okay, no, it's not distracting, Lucy. We sat and we had to get, we went deep, deep, deep into FDA and USDA requirements in order to get this. So let us defend that labor to you. All right, next slide. And I said, quote, groceries. I think we're still going to use the word tailor because of how it's bind to RDM, but that's like one of the few things, like, what do we call this? The degree of tailoring is different, but we just wanted to leave space. And so my apologies for this being in parentheticals. For all intents and purposes, we'll likely call it medically tailored groceries given the binding to RDNs. But there was this last minute revelation that happened, right? So we had this, and you're going to see this on the next slide. This definition is not the same definition that you saw 2 weeks ago. Next slide. It directly aligns with medically tailored grocery because after reflection, there was a desire to differentiate clearly the groceries that are provided to support within a therapeutic diet to support specific conditions from groceries that are just healthy, right? Our last time we were here, we we're talking about groceries aligned with the US dietary guidelines. So specifically, the work group decided to lean in and really from the evidence and science to specifically say, no, this is a thing, right? RDs are involved, RDNs are involved. All of my, they're just double checking, all of my dietitians are spelled dietitian with a T. I double checked. So the service description is shelf-stable produce, shelf-stable products, produce and other perishables if able. And just a note, this if able is part of how we can address the legumes component and the different types of things that we have in the produce element, just noting that language is likely going to be borrowed into the other produce concept, designed to meet at least a third of the comprehensive recommended intake for one person per week per therapeutic evidence-based dietary specifications or conditions, assigned based on an assessment of an individual's nutritional needs by a registered dietitian or other nutrition professional as part of a therapeutic diet plan. And very clearly in this instance, we're saying a base truth is that if you're adding produce and other perishables, that will be addressed by a modifier. Right. And it just kind of goes into what our friends from Vouchers for Veggies were saying. Right. So this directly aligns with the medically tailored meals concept. It leaves the healthy groceries concept. We still have that. So Katie and I get to decide. We were going to address non-medically tailored groceries in 2025. We already have a definition for that. So it's kind of like we can use that already. So we're just going to like reconvene and kind of talk to our advisory committee on what to do next on that concept. All right, next slide. Is the 1/3, how would you, Alyssa, can you?
Sure, for groceries, MTG folks, is the 1/3 of, if you can go back one slide, Sarah.
Yeah.
How would you scale the 1/3 of recommended intake? Would that be, because a lot of meal bags right now are like meal equivalents almost. So would it just be scaling those RDIs or DRIs, dietetic? I'm guessing it's a yes.
Yeah, I don't know if I understand your question. I'm so sorry. It might be just like facilitation.
That's okay. Groceries tend to come in bags, not meals, which are like easily recognizable, right? A meal is a meal is a meal, although components aside.
Yeah.
So within a bag, the recommended unit here is 1/3 of the recommended intake for one person
Per week.
than meal equivalents. So I'm just calling attention to that and saying we would scale based on recommended intake rather than meal equivalents, right?
Correct.
Grocery folks, cool. Thank you.
Okay, I got it. I'm so
Get
sorry.
it. Sorry.
No, I'm good. I'm good. Yeah, sounds good. Okay, yes.
And
Okay.
I think to name it very simply, if you were a group that did 2/3 of groceries, it would be 2 units of this code.
Got it. Perfect. Thank you, Katie.
Okay.
Sorry.
And 2/3 because of this one is as far as you can go because of, yeah, we're not going to go there. But you know, okay, next slide. This is just the concept we presented before, which we started here 2 weeks ago, and then the medically tailored groceries concept changed significantly. This still exists, and it addresses the need that we were going to cover in the spring of 2025, right? Because if you if we can go back one slide, actually. It's important to note here that we use, and Alyssa, you were part of this, we use the word conditions because from a medical necessity perspective, this type of grocery provision is used to support both specific conditions like diabetes or heart failure or hypertension. It's also used for high-risk conditions like perinatal health, right? And so those are all like tailored for the person, right? But there's plenty of instances in the ecosystem where waivers are supporting provision of, groceries, not aligned with any condition, just healthy. And we think about pantry stocking efforts with like housing navigation, et cetera. And so if we go to the next slide, we crafted this in our medically tailored groceries concept because originally we were going to represent the tailoring in a modifier. We already did this, so we have to figure out what to do with it. And so we just didn't want to not present it, right? So we already have a definition for something that is not tailored, is not bound to an RDN, and is not crafted for conditions, but is just crafted to support a healthy diet based on the US dietary guidelines, right? So this work was already done. And so just noting that this was already done, I'm not going to like bomb you with a vote on it today, but it exists and it was supposed to be addressed in 2025, but we already kind of covered it. So just noting that this was what you saw 2 weeks ago for the groceries concept, and it directly supports the concept that we wanted to address in 2025, and we'll figure out how to go forward with it, but it exists as knowledge working. Hi, Lucy, yes?
What if somebody grows their own food? Very few people do, I'm sure, but the constant use of the term groceries to me
Yeah.
implies that you go to a place to buy something and pay for it. What if you're a person with a condition eligible for all of this service, but you're growing it? Does
Yes.
that?
I think we talked about something like this a couple meetings ago, but the cool thing is that because with the tailoring concept, Lucy, this wouldn't apply here, right? Because there's some degree, the qualifications for this are usually a degree of financial necessity that would drive needing the grocery provision. But in the tailoring, what you have on hand is part of the assessment, right?
Great. Okay, thank you.
Like RD, like, one of the things that we learned, which I didn't know, is in like the Midwest, groceries have RDs grocery stores have RDs who are in the grocery store who can help you buy like groceries to align with your conditions, and they figure out what you have and what you don't have. I never knew this. Go Midwest groceries. Okay, so this is the end of the coding for food concepts, and the vote comes if you go next slide. Oh, sorry, this is what next slide is working with A&D on the statement, right? Thank you, A&D, incoming. We'll present to the different operating committees. And then we have some wordsmithing to do, and then we submit to CMS in December, in early January. Okay, I'm thinking. Oh yeah, it doesn't come that it must be come from a supermarket. It's true. Okay, sometimes it comes from food banks. Sometimes it comes from, definitely produce comes from your local farm all the time in farmers markets. Okay, next slide. Coding for Food vote, Coding for Food SMEs, gather round community. So everyone is a Gravity committed member. Please come and vote. And then anyone who was part of the Coding for Food work, please vote as well. How do we? Oh, you can vote, you can request an absentee ballot and vote by next week. If you have ideas about, first of all, we're going to be dropping the link to the chat in the chat to vote, but it's important to note that like from a purpose of voting, you vote either if you were a member of the work group or if you're part of Gravity, because we did want to make sure that we don't have like people coming from outside and like significantly changing the consensus you all arrived at. But we will, the polls coming soon. Huh. All right, so remember, yes with comment if you have ideas, right? Again, no significant changes can happen right now. So if it's a wording suggestion, please let us know. Because even yes with comment says that it's going to be addressed in future versions of the deliverable. And we've been here together for a very, very long time. So just be careful. And then there's formal objection, which is we have to put a comment in as well. And then there's abstentions. And so I think Sarah B. Hall is going to release the vote as it stands now, and we'll spend the next chunk of time on language access, I believe. So Jennifer, you can send, you can think and then vote. And Sarah B, it's still the 28th, correct?
So our poll is set to close by end of day tomorrow. So, but if
Oh,
we need to, we could
no,
consider
no,
extending the deadline.
because you were supposed to ask for an absentee vote ahead of time, right?
Yeah, that's correct.
Great. Okay. Okay. Perfect. Okay. Right. Okay. So now it's time. So sorry. Vote by end of day tomorrow. Fantastic. And then okay, and we can do that. Sounds fine. We can if you also could just copy the link and give it to her. You know what I mean? Okay. Amy, yes. Great. If you just copy the link, yes. Amy was critical in our pounds. We love you, Amy. You were part of every meeting. We want to make sure you're part of the vote. Anyone who is part of this work, and so if you want to, Sissy, if you want to represent vouchers for veggies, because Alex isn't here, that's also okay. Like I feel like that, but I mean, if you are we're a member of the working group, or you are a gravity committed member and part of this work, you can vote. Oh, Alex is here. Hi, Alex.
Hi everyone, I'm here. Yeah, sorry, my Zoom
Okay.
default's to Alexandra, so I'm a little incognito.
Uh-huh.
So it's one vote per organization. That's part of it.
Yes.
So thanks, Sarah.
And gravity members, gravity people, also vote. Don't forget to vote for the Coding for Food stuff. And this is just again just trying to make sure that I am a committed party. I'm voting right now. I'm doing it.
Yeah, just click on that link and vote right now. I just did.
I did too.
Easy.
If
I'm so glad it was easy this time, Lucy.
if we're a coding for food person, are we a committed member?
Yeah, so for this purposes of this work, you are committed.
Yeah, committed member. Thank you.
I guess, I mean, that part doesn't matter as much. We just want to make sure, as you can imagine, not that we have like hot topics here, but we don't want last minute voters to disturb the consensus you all have established, right? So we
Sarah, answer Misty's question. What is a group member called? Is that a committed member?
yeah, we just said that was fine. Yes.
Okay.
Did you get it, Michelle? Okay, this is always what happens. Everyone have the link? Everyone good? Okay. Yay. Amazing work, friends. Until tomorrow. So poll close when? Oh, here you go. Oh, you email the comments by 11. Sorry, that was where I got the poll closes tomorrow afternoon. You email comments by November 28th. Thank you. I'm so sorry, Sarah. I'm like in my facilitation fatigue. I'm forgetting very easy, very basic principles. Thank you, Corey. All right.
Now, having voted, I want to thank personally the huge number of people who committed to attempting to standardize understanding and terminology for what's really a very complicated problem. And my questions just show if you come at this without having thought about it for the last 50 years, you have a lot of questions. I don't have any conditions, but I want to be healthy. What are they going to tell me? You know, like that. So thank you, everybody.
Indeed. Thank you so much, our Coding for Food SMEs. We could not have done this without you. Thank you, thank you. And produce prescription, I'm coming to you. We have one more meeting to ensure, again, produce prescription gets a lot of pushback from payers. And so all of the wordsmithing is just trying to make sure that they can defend the quality of the services they offer when they are faced under the scrutiny of payers and contracting. All right. Thank you, everybody. Okay, now we're flipping into the next section of the agenda, Coding for Food Friends. You can feel free to stay. We're going to be going through a ton of, yay. We're going to be going through a ton of concepts about language access and incarceration status. It was a big fall, friends. Thank you, Katie. I love Katie Etman. You're not going anywhere. Luckily, I'll see you.
You can't get rid of me that easily.
I know. I will see you in 2025, friend. All right. Jillian, you're just the punniest guy. Look at you. All right. Thank you, Coding for Food Friends. It's been just my sincere pleasure. And again, thanks for bringing this farmer home to food. Make me emotional. Bye,
And
Carly.
may all the payers take this up.
Yes.
That's our big wish now.
Yeah, we're doing it. Yeah. Love you, Carly. So bye, Carly. We'll get your brief and we'll put it in front of from your eyes to the powers that be. We got you. Carly's from the American Academy of Nutrition and Dietetics. Thank you, Carly.
Sounds great. Happy to be a part of this. Thank you for including me.
Awesome. Thank you. Okay, we'll find you all for evidence and the mayor submission. Just know that you still have homework for us. Okay, on to language
Love
access.
it. I'm there for it.
Yes, great. Okay, on to language access, and then the next set is just one poll. Okay, so we're gonna go through a lot of content. There are very few changes, so this is a lot of slides to cover. I think there's like 60 slides, but we're just gonna move through it. Whew. An amazing thank you to our language access subject matter experts. I was reflecting today because I tried to post on LinkedIn to anybody like, come one, come all to the gravity terminology call. Just how significant an effort it was, like to like just considering the gaps in terminology to support class services and knowing how important culturally and linguistically appropriate services are, and collectively understanding gaps in language value sets that, assigned languages just weren't there. Like it's very basic, fundamental concepts, not represented until all of the work that our subject matter experts assisted with. So thank you, SMEs. And then given our work in the spring, some of them, given that they're given that they're immigration status experts, I will be coming to them again. Next slide. Next slide. So we tried to make this really super simple, right? So we have our English proficiency concepts in spoken and reading English. Next slide. We have our concepts for interpreter needed, signed language interpreter needed, and translation needed. Next slide. We have our proposed, again, I have, for any of you who do the ICD crafting, I have a proposal for the ICD coming very soon into your inboxes. It was a very busy week, but I hope to get it to you by the end, by midday tomorrow. So we have our interpreter needed concepts. We have the existing ICD it maps to, and we have all the new ones, requires in-person language interpretation services and in-person sign language interpretation. To marry the existing requires telephone language interpretation services, and just trying to think from a patient-centered perspective. Next slide. Again, we have a new translation needed concept, again, asking for a new ICD to support that as well. Next slide. Assessment instruments, we have a very tidy small set because we had very high standards. Next slide. There we are focusing on preferred language for communication in healthcare, really supporting Joint Commission and CMS culturally and linguistically appropriate services. So right now, the only preferred language concept we had was the SAMHSA preferred language question. Next slide. And then we have interpreter needed concepts. The example was in the IRF PAI instruments, and then just elevating that this is a great opportunity to have one of the I speak methodologies, like do you need an interpreter in that I speak method in the person's own first language. Next slide. Our English language proficiency mirrors the US Census Bureau. Next slide. And so you can see the incoming American Community Survey Census Bureau, how well do you speak English, and the best in class answers. Next slide, we'll be working on encoding that, and then a mirroring question with different answers from the National Latino and Asian American Study. Next slide. Goals. Very simple, straightforward. Again, throughout this domain, the focus was really on the goal being the system meeting the person. There are all kinds of other concepts that exist, but really wanted to stress that from a class standard and from a Joint Commission standard, it's really about the system meeting the person where they are. So the meta goal is effective communication. And then we have two sub goals that we're still tweaking definitions on. which is receiving consistent qualified interpretation and preferred language for healthcare, and then timely. And timely is one of those measurable components within the class standards. Next slide. Okay, next slide. Programs, professions, and roles. So we have all of those critical helpers, ever so important. Again, the great thing about this is it's all really stable. You've been seeing this content. We all worked in it for 4 months. Go team. Next slide. Again, thanks to our SMEs for recognizing that you do not refer to, you request services to come to the person. So concepts for interpretation and translation. We have one critical gap addressing the request for document translation. Next slide. There you go. Look at that tidy business for language access. Any questions on language? That content's been so stable. I'm thinking we're probably good there.
Sarah, why aren't we voting on that now? Like language and incarceration are two quite separate domains.
Well, because we have always voted for them together. There are different areas of voting within the poll, but the only reason why we separated it out was because none of the coding for food work happened they happened in separate meetings. And so there's people that were in coding for food that had never seen this content before. But we only usually make one poll, but it has an opportunity to vote for everything in specific, I promise. You can have different votes for things. All right, and I promise that we do want to allow people to have flexibility for different types of votes for different things. Okay, whew. And my facilitation brain is a little sleepy, but I think we're doing pretty good. Okay, on to the concepts. Next slide. And again, first of all, these amazing subject matter experts. I see Kwesi here. Kwesi, you've been such a gift. Frankly, I'm just so grateful for you. I don't know if any of the other SMEs are here, but just masterclass in learning with you and everybody else, and just thank you so much. Luckily, again, you guys will not be far from us as we work on these concepts because you're so committed to getting them well represented. But thank you so much for your expertise. It's been amazing. An amazing set of clinical researchers and social workers and DOJ representatives, like just really amazing. And especially a call out to Milan and Rada, who spearheaded this whole work, right? They were the ones that came up to me at the ARM meeting a year and a half ago and said this needed to happen. And so when the reentry waiver and the request from states to build these concepts came to light, I just emailed them. And I said, hey, remember me from ARM? And just very, very grateful for their brilliance and ethics.
And Rada is also on, Sarah.
Oh, Rada, here you. I didn't even know you were on. Here I am giving you flowers. Thank you, Rada.
Appreciate it.
Amazing.
Thanks,
Amazing, amazing. All right, next slide. Whew. Okay, core concepts. Next slide. I just wanted to note that there will be some wording changes. Again, our SMEs are really, really careful with us to make sure we word these things right. So we're going to be making sure that we keep them close as we go forward to modeling these concepts going forward. Next slide. So we have our currently incarcerated concepts. These are not changed since last time. Next slide, which is again, the currently is not on there, but it's just incarcerated. And we currently have the ICD-10-CM concept that maps to it. It couldn't all fit on one slide. Next slide. We have the incarcerated and expected release within 90 days. This is a critical concept to support reentry waivers. Next slide. We have these ICD-10 concepts. They're still italicized. They are what exists right now. We haven't worked with our SMEs on whether they want to demote and suggest new concepts yet, but we leave room for that as we go forward. This is what happened. These are the concepts that roughly map with these concepts right now. We've talked about how they're problematic so far, but we're still working on possible solutions. Next slide. This is a change. a really, again, incredible thoughtfulness regarding how to express how the concepts within this work are experienced in the ongoing lives of affected individuals. And so we landed on the language experiencing ongoing effects of solitary confinement to represent the solitary confinement concepts that we talked about last meeting. And again, thank you for, and we had really powerful conversations with the SMEs on the different types of solitary confinement and trying to make sure we could tell critical stories without creating something that was untime boxed and like just a history of concept. Next slide. It looks like we also leveraged that experiencing ongoing effects concept to tell the SMEs elevated that they wanted to be able to tell the unique histories of youth who are incarcerated in adult facilities. And so we leaned into that experiencing ongoing effects from being incarcerated in an adult carceral facility as a youth concept as well. We talked about it being an emerging concept last time, and we settled on this as the pathway for this in solitary confinement. Next slide. We did clarify our language and reword our language on that initial post on the initial encounter. I was really grateful for those of you who talked about concerns with defining visits last time, and we had some wordsmithing to do. Grateful for our friends, Andrea at the VA, who had some word ideas. And so the new concept for that first encounter, which again is critical no matter when it happens, is initial post-release encounter with care team during reentry from carceral facility. One thing I want to note really importantly as well that our SMEs have consistently elevated is the importance of peer support and community health workers and their critical role in this work. And this word was crafted with that in mind, right? Because of the evidence and just incredible advocates, our SMEs, for lived experience and peer support and community health worker in reach and outreach and support. So this team, this is a care team phrase for supporting that critical work. Next slide. And again, SMEs, feel free to say anything. We centered, our SMEs centered and simplified our time frames to be based on the literature and trying to simplify things into the month and the past 12 months. Again, using that reentry concept, centering on the stories that are to be told there. Next slide. We follow that same pattern with juvenile facility. Next slide. No changes here. So we have under community supervision to define all the different types of community supervision, really careful not to overly subspecify this. And then critical enrolled in treatment court programs with a synonym of enrolled in specialty court programs based on the amazing guidelines of All Rise. Next slide. We have our legal needs concepts that align with medical legal partnership that can tell specific stories of legal needs and how they intersect with social needs and healthcare needs. Again, the MLP work and all the work happening in the administration of children and families is good literature here. Next slide. And as you are aware, next slide, we have no assessment instruments for this at this time. So this is a first for us. I do want to note that some of our subject matter experts are already, as I mentioned, conducting qualitative research to understand perceptions of being screened for histories of incarceration with individuals who are currently incarcerated, specifically about the healthcare use case. So there will be, this gap may be filled in time with a better assessment with evidence that individuals with lived experience find it beneficial, but for right now, it's a gap, intentionally. Next slide. Goals, lots of goals, lots of beautiful additions to goals. Next slide. We have so many. And again, I'm going to keep on like throwing flowers towards the SMEs because one of the things that was so powerful was how much time they spent thinking about goals. carefully thinking about like advocacy and support and self-determination theory, and more time spent in this than most any other domain. I think just goes to show how we're surrounded by care providers and clinical researchers and social workers and people very in this for the right reasons. So just grateful for the amount of time that was spent there, and the amount of concepts that are going to be in the system in terminology to support critical stories. Next slide. Again, these all exist in SNOMED right now. Next slide. And as do these many of these are concepts that came from previous domains, but will be included in this set. Next slide. But then we have a host of new ones, which, really are applicable to far more domains than just this, but because we're elevated again by the care of our subject matter experts. So thank you so much. These are very fundamental to care for many people. So thank you. Next slide. Right. Next slide. Again, these are constant. I just mentioned how our SMEs have elevated the role of peer support and community health workers in this work, and those are all part of our core sets that are included for every domain. But there's specific new programs and new roles that we have as well. Next slide. We have community-based reentry program, veteran justice outreach program, halfway house. Next slide. Forensic peer support as a specific expertise, prison doula programs, and parenting while incarcerated programs. Next slide. Recovery, again, I mentioned this last time, I mentioned it again, just again, incredibly grateful that our SMEs have consistently elevated the role of mental health and substance use treatment throughout this domain. And so just making sure that we had the programs to support people in mental behavioral health and recovery. Next slide. And then we have our family reunification services, family strengthening programs, and the best-in-class transitions clinic as an example for programs as well. Next slide. And then doulas. As I mentioned before, when we can refer to programs, but if we refer to a profession, the profession has to exist in the National Uniform Claim Commission Claim Committee taxonomy, and doula does exist. So we'll have a refer to prison doula program and a refer to doula, right? There is a doula is the specific profession that's called out in the NUCC. Next slide. I do not think so, Denise. I see that. I'll do a quick look. So this is the intervention framework that wraps around all of those the terminologies from language access and incarceration. I just mentioned them a little bit, like refer to, education about each of these different programs, coordination of needs to address histories of incarceration, adjusting treatment plans, right? So all of this is the core gravity syntax that wraps around all of our all of our concepts to create that eventual SNOMED term. Next slide. We have a quick all domain program and gap analysis consensus vote next, but I want to pause for a second. Any questions on the immense and powerful work that our incarceration status SMEs led us through over the last months? It makes me emotional, this domain, as they know it. Again, I cannot express how grateful I am for all of you. It's been a very powerful time, and luckily you're not going far. So
I think all of us, Sarah, have been more than grateful, sometimes overwhelmed, to be participating in a conversation about conditions of life that we may not have personally experienced, when those conditions are so profound and radiate through society in terms of what society is saying about certain people.
Thank you, Lizzie. Yeah. It's been an honor. Thank you, Smeeze. You know that I appreciate all of you. Okay. So if there's no questions, I'm gonna slightly pivot because we have, oh, it's 5:11. We're doing okay in time. I know coding for food took a little bit, and we're gonna just go through the other, because this is the terminology, new domain work. So there's all the all domain revisions and all the concepts that came up in our program gap analysis are also going to be part of this vote. And then gravity terminology team, the mighty four, work on submitting everything. And not just the mighty four, because I just want to note all of our ICT concepts. Again, I owe you, I see you, Sue. We have 2 concepts coming in from Language Access, and I have an email and a draft out coming in for our ICD. We have amazing support from experts in AHEMA and AHA, and our friend Linda Hyde, who used to be our my terminology co-pilot, help us get our ICD concepts right. So just a few more things on all domain revisions and program gap analysis, and then our vote. Next slide. So these are just, concepts that we identified that we did not have, and we thought we needed. These are already existing concepts. They're going to be added to our value sets. Next slide. And then these are all gaps, and we presented these in our enhancements meeting. Probably should have put these in the coding for food vote, but these are all gaps in programs that have come out through our program classification work. Right, so we're working with EPIC and Find Help and Unitas and 211 HSIS and 211 San Diego on creating this open program classification. We presented these concepts a bit like through that work, but these are all gaps when we went through, what the programs they wanted to connect to in the classification and gravity concepts to support that. These are all gaps that we have. So it's like infant food, community nutrition programs, including the evidence-based YMCA diabetes prevention program. It's not often that unique programs are elevated, but this one is best in class and specific and national. So that's what rises it up. Vehicle loans, diaper bank programs, supposed to be infant supplies, I think. Diaper bank programs are huge. Next slide. Housing navigation, we didn't have that concept, but we actually presented on Housing Navigator being a critical missing role to NUCC when we went there. Coordinated entry, hospital, guest house, crisis houses, public housing programs, tribal housing programs. These are already some of these are gaps, but and the public housing program is already in the works. Next slide. Housing choice voucher programs, community trust housing, single room occupancy was a missing HMIS concept, federal housing authority loans, and then some concepts that came out through New York, medically necessary home modification programs and home asthma trigger remediation programs. Those relate to inadequate housing. Next slide. And so that's and if we go back one slide, sorry. So part of our job in Gravity in 2024 was completing this gap analysis, right? So we have all of these programs, what programs are missing. So this is the first release of those gaps to fill, of those identification of those gaps and program concepts to fill those gaps that will be built into Gravity syntax. Whew. Yes, Denise? Hi.
Oh, sorry, that mute button. So where does the residential housing gap fall? I'm sorry, you probably know where it is. We had a gap.
Which one?
Was it residential housing that we didn't address? Was that a gap, or did we decide it wasn't a gap?
I don't know what you mean by residential housing. We have many different housing concepts that came out of our work with CDC and program enhancements. I don't have one for residential housing.
Okay.
But we have lots, if you go to the next slide, we have lots of housing concepts. We have, oh, sorry, it was the previous slide. I'm getting a little bit. We have public housing program, tribal housing program, housing navigation. We have other concepts for housing, but I don't have a residential housing concept.
Okay.
Okay. So I think now if we are willing, we are ready to go to the next vote. Are you with me, friends? So this is a vote on the language access concepts. This is basically a vote on all the new, all the work we've done in the new domain work, right? So we have language access concepts, we have incarceration concepts, and we have carryovers from that we identified as gaps for all domains, and then we have the gaps that we identified with our program enhancements work. Whew. The votes are still the same. Yes, yes with comment, formal objection, or abstain. The poll is still open until tomorrow afternoon, and you need to submit comments to Gravity by November 28th. And I think Sarah B dropped the, here we go. If you all want to access this other form to do the vote, we can do this now. Understanding that, oh, and here, and Lucy, you can see each of the domains is separate. Okay. Why does this domain make me so emotional, Chrissy? I swear. It's just, whew. It's injustice, I think. It must be. And that was it, the injustice coupled with all of your subject matter expertise, care, and compassion. I think it's like a dual feelings. All right, does everybody have access to the poll? Submitting, are we good? Thank you, Sarah B, for crafting the polls, for delivering the polls, for serving Sarah Ball. Like, just amazing human. Sarah B, we love you. And now the next step is the worker bees, right? We go into worker bee effect and start submitting. Thank you all. Thank you, subject matter experts. Thank you, community. It has been an amazing fall 2024. We have a couple more meetings with the SMEs just to make sure that we do things as they advise us to. We couldn't have done any of this without you. All right. So I think right now we're ready to close. Again, we're reconvene. This meeting quiets until February 6th when we reconvene, because all of the Gravity terminology team goes operation, mission, submission. And do all the different things that we have to submit, including kickpick concepts to Maris and ICD submission to NCVHS, and SNOMED concepts are the gentlest one. We have no LOINC submissions from this domain, for these two domains, but there's a lot of work to do, and we'll see you on February 6th, and you'll see me in the tech call. Thank you for the Thanksgiving wishes. My aunties are all coming, and my daughter's bringing back friends from college, and I cannot wait. It's going to be Sarah and her aunties, and my daughter and her friends who can't fly home, and my son who's over there. I appreciate all of you so much. Thank you for being part of the Gravity community. I will miss you. I always do. And I cannot wait to see you again February 6th. And I cannot wait to see you in all the other places. And SMEs, I will see you tomorrow. Thank you so much. Amazing work, friends.
Bye.
Bye.